Hello, everybody. I'm just going to ask my colleague Abby, can you hear me? Is that sound working okay? She says yes. That's great. I'm Rachel Duke. I'm head of charity at Heads On. I'm just going to give it a couple more minutes because we've had a few emails from people saying they're having difficulty getting either Eventbrite to send them the link or Zoom to work. So we'll just wait 2 minutes and then we'll get started just to give everybody a bit of a chance to kind of dial in and get the tech working. We've also had a few tech issues ourselves, so hopefully those are resolved now. I can see people saying hello and everything, so fingers crossed it should work. Thank you. Hi, everybody. It's sorry, distracted by comments in the chat about people having to put other people, which is really lovely. So I'll start properly now. If anyone can't hear or see or anything kind of goes wrong with the tech, can I ask if you could please use the Q&A function to tell us rather than the chat? In a minute, once I get going, the chat's going to get hidden and we won't be able to see it. So yeah, basically, if you want to contact myself and my colleague who's kind of doing bits around behind the scenes for us, please use the Q&A function because that will be the one that we can see, and that's the one to use for questions, which I'll explain in a minute. So I'm Rachel Duke. I'm head of charity at Heads On. Heads On is the NHS charity for Sussex Partnership Trust, and we are managing this grants programme on behalf of the Sussex Health and Care Collaborative, Mental Health Collaborative, sorry, Sussex Health and Care Partnership. I'm going to go through this morning just a kind of overview of the total funding. There's 3 different bits to it. Talk specifically about this funding round and how to submit a kind of good application. We'll talk about what we learned from the first funding round because we ran 1 round last year, and then I will also be taking questions. What I would like to do with the questions, if people can ask them using the Q&A function, which if you're looking at Zoom should appear for you kind of at the bottom in the middle, each section I'll do questions as we go rather than saving them all up to the end. There will be an opportunity again at the end, but I think as we go, it's probably useful to kind of cover those off as we work our way through. If you've got questions that are specific to your organisation or your project, can I ask that you please contact us separately via the grants email, which I'll pop in the chat in a second. What I want to focus on today with this, because we've got quite a lot of people on the call, is the overall funding and answers that are useful for everybody. We're really happy to have specific conversations with you about your individual projects, but we'd ask that you keep those separate to this webinar. Also, just to say the webinar is being recorded, so the content of it, I would just say when you ask those questions, just be mindful that it won't only be the people who are on this call this morning who will hear those questions and hear the answers. It's also going to be posted on our website later. So I would suggest please don't put anything that you would consider to be confidential or business sensitive in those questions for us. Hopefully that all makes sense. I know several of you on this call, so I'm sure someone will tell me if it doesn't. So that's fine. So I will just kind of get going, really. Thank you very much for taking the time on a really miserable January morning. What a welcome back. So this funding is a £600,000 grants pot overall, and like I say, we're managing it on behalf of the Mental Health Collaborative for the Sussex Health and Care Partnership. For anyone who doesn't know, the Sussex Health and Care Partnership is an integrated care system. It sits across the whole of Sussex, covers the whole of the population, and it covers both physical and mental health. But this funding stream is particularly mental health focused, and it is only for organisations who are voluntary community and social enterprise organisations to apply to. The funding, we are running it and allocating it through open grants calls. So we've had one grants call already, and this is the second one. Of that 600,000 is split into 3 different funding pots. So one is innovation, which is does what it says on the tin, really, for people to test new work and pilot new initiatives. Build, which is to grow and develop existing programmes of work. So, for example, that could be something that you've delivered in one part of Sussex and you want to go and deliver it in another, or it might be that it's something you have delivered with a particular group of people and you want to extend that into a different group of people. And then the final one is grow, and grow has not opened yet. Grow will open in a couple of months' time with a deadline in May, and that is investing in the growth of actual voluntary sector organisations in Sussex. It's not a huge funding stream, just to manage expectations. It's 125,000 across some different priorities, but you will be able to apply to that as well. We'll do a separate webinar about that. So I'm only going to talk about the current funding opportunity today. And within that, it covers both innovate and build, but all projects, the only funding priority that sits across both of those streams for this round is projects that will support the community transformation of NHS adult mental health services in Sussex. So we had suicide prevention as another funding priority at the previous round, but all the funding for suicide prevention has now been allocated. So if you're here this morning because you thought you were going to submit a suicide prevention project, please, it won't be eligible under this funding round. So just bear that in mind. I'm going to talk you through the priorities anyway, but just to kind of get that out there from the beginning in terms of what's available. Within those rounds, there are different amounts of money that you can apply for innovate and for build. And sorry, I'm flicking between different screens so that I can give you different parts of information as we go through. So both of these have got a shared deadline of noon on the 31st of January. So for anyone who hadn't seen that, I just want to put that out there from the beginning. And in terms of delivery, it will take us about 8 weeks to complete the assessment process, and projects must complete by summer of 2024. So you've got slightly over a year from when you get a funding decision to deliver and evaluate your work. For Innovate, which is the pilot funding stream, the minimum grant that you can apply for is £5,000 and the maximum is £15,000. For Build, the minimum you can apply for is £15,000 and the maximum is £50,000. One piece of learning to share from the first funding round, and I will talk more about the kind of overall things that have kind of influenced this funding round from the first one, is that we, at that first funding round, had over £1.5 million worth of applications for less than £300,000 worth of grants. So the quality of what we had was very high. The scoring threshold consequently was very high in order to be successful. The largest grant we made under community transformation was £25,000. So in terms of those maximum grants of 50,000, they are available, we will consider them, but I think they are unlikely to go to a project that is just delivered by one organisation in one small community. They're more likely to be awarded to perhaps a partnership project with some different organisations working together, or something that had kind of bigger impact in terms of perhaps numbers of people involved or different groups of people, for example. These aren't rules, but they're based on the kind of scoring that we went through previously, and who scored highly and who was awarded funding, and difficult decisions that we had to make around how much funding was available, basically, versus the number of applications that we had received. The other thing to bear in mind across both of those funding priorities is that we need to achieve, as a funder, a spread of projects across the whole of Sussex, so East, West and Brighton and Hove, and also different groups of people. So different needs, for example, so people who might struggle with substance misuse, people who are homeless, refugee and asylum seekers, women with complex trauma needs who are perhaps also using perinatal services. So it really broad spread of different groups and different needs, and we are trying to achieve something through the grant fund that's kind of spread across those different areas. So just sort of bear those sorts of things in mind when you're thinking about what you submit and how much you ask for. So the community transformation, and I did post, I don't know if it might have got a little bit lost in the chat. I did post earlier the link to the guidance notes. They are on our website, and I would really suggest, if you haven't done already, you go and read those, because there's quite a lot of detail in there around kind of what we're looking for and where the application form is weighted in terms of scoring. Also, after today, we're going to do an FAQ sheet which will cover some of the stuff we've learnt from the first round, but also questions and things that people are asking us today. So before I go into the next section around those priorities, I'm just going to quickly click so I can see that I've got a couple of questions in the Q&A. Can partnerships include organisations from Brighton and Hove? Yes, they can. Yes, there is a point in the guidance notes that we're particularly keen to see applications coming from East and West Sussex. That's because in the first funding round, we received a disproportionately high number from Brighton and Hove compared to the rest of the county. But yes, absolutely. And we will still fund work that takes place in Brighton and Hove. It's just we are particularly keen to reach out into East and West because those areas were underrepresented in applications last time round. Second question is, can we apply for more than one grant? For example, 5k from Innovate and 15k from Build. Yes, you can, but it is unlikely that you would get both for the reasons I've just explained around trying to ensure a spread of funding across Sussex, across priorities, and also across organisations with a kind of reasonably small pot of grant funding that's coming from a public source. We would want to try to spread that across different organisations. I think I've covered those, unless there's another one. No, that's it. Okay, right, I'm going to go into then the funding priorities. So bear with me as I just scroll through. So as I said earlier, this particular funding round is focused solely on the transformation of adult community mental health services in Sussex, and as someone's just commented, particularly keen to see projects delivered in East and West Sussex. Actually, just on that point, it's about where the project would be delivered. It's not necessarily where you as an organisation are based. It's actually about where you're going to go and do that work and do that intervention. Given the demand for the funding and what we had last time round, and we received far more applications for Build than we did for Innovate, and thinking about the ones that were consequently funded last time, one of the points to make, and it's in the guidance notes, the ones that tended to score the highest were the ones that were most closely aligned to the transformation programme, and also that particularly were ones supporting people with severe and enduring mental illness. Because the community transformation programme is around the transformation of NHS community services and building this funding around building much stronger partnerships with the voluntary sector, projects that had those links already, or that had demonstrated how they were going to build those links and perhaps had already started some of that work, and that were really focused on people with severe and enduring mental illness, tended to score more highly than ones that maybe hadn't done any of that work yet. So just to kind of say that really, and again, you know, think about the conversations that you might need to have prior to submitting applications. If you are a bit stuck on who to talk to within the NHS about the work that you want to do, please contact me and my team. We're based in the Mental Health Trust, so we've already helped quite a few applicants in terms of signposting them to the right people to go and talk to and doing some introductions. So if we can do that and it's useful for you to ask us to, then please do. That's absolutely fine. Overall, the transformation of NHS community mental health services is a national programme. What we've outlined in the guidance is some work around what we're doing in Sussex, basically. But the overall principles are around supporting people to live well in their communities, to access mental health care where and when they need it, and manage their own recovery on their own terms. And that people would have around them as they do that, family, friends, carers, social networks, those sorts of things, and that people might feel able to contribute to and be participants in their own communities in a way that works for them, whatever that might look like. So in Sussex, our work, as everybody nationally, is very closely aligned to the NHS long-term plan, which recognises the role that the voluntary sector can play in supporting people with mental health problems, particularly in their communities, and particularly in the work that most voluntary sector organisations have done for a very long time around addressing health inequalities. Within community transformation, there are 3 areas that we are looking to support work in, and just to reiterate, these are across both the innovation and the build strand. So there aren't separate ones for each, these are the same. So the first one is around improving access to mental health care, particularly for groups who face additional barriers to accessing healthcare. The second is building mental health resilience in local communities. And the third is addressing the social, oh, sorry, someone has said, can I slow down, please? I've seen that straight away. Yeah, I'm really sorry. I'm trying to whiz through it in an hour, sorry. It is being recorded as well. So if you, please don't feel you've got to write down everything I say. You can watch the recording as well. Sorry, I will try and slow down. And we will do the FAQs as well. Okay, please tell me again if it's too fast, by the way, the person who wrote that message. So I'll go through these 3 things again then. So improving access to mental health care, particularly for groups who face additional barriers to accessing healthcare. Building mental health resilience in local communities. And the third is addressing the social determinants of health and health inequalities. When you go into the guidance notes, on page 7, there is a section around what we mean, or what the World Health Organization actually means, to define the social determinants of health. So to give some examples, and these are things that would, they are non-medical factors that will influence health outcomes. And forgive me, because I know there are a lot of people on this call who know this stuff backwards, but for people who perhaps don't or haven't had it talked about in this way before, I'm just going to kind of cover off what some of those might be. So they are the conditions in which people are born, how they grow, work, live and age. And they are a wider set of systems and forces that can that kind of shape our daily lives. So they will include things like income and social protection, education, unemployment or job insecurity, working life conditions, food insecurity, housing, basic amenities, the environment, your early childhood, social inclusion, structural conflicts, and access to affordable health services of decent quality. And there's quite a lot of research that shows that social determinants of health will account for between 30 to 55% of health outcomes. So they're really important in terms of people's life expectancy, if nothing else. And can, sorry, I'm just going to minimize these questions because I'll come back to them in a minute. In terms of health inequalities, which are the kind of consequences of those, an example of that is that people who live with severe mental illness have got a life expectancy of between 50 to 20 years lower than the rest of the population. So that section around social determinants of health inequalities, those are the sorts of things that we would be looking for applications that were focused on under that 3rd priority within community transformation of addressing the social determinants of health and health inequalities. To give some examples of kind of groups that we had applications around in the first round, we had quite a lot of applications for projects working with refugee, asylum seeking and migrant communities. We had applications from people who were working with groups, for example, travelling communities, applications around women in certain areas of disadvantage across Sussex. And we had applications around age, and an ageing population is one of the biggest challenges we face nationally, but also particularly in Sussex. So if you've got if you've got a project that you want to deliver that's going to be focused around social determinants of health and health inequalities, one of the things you just need to note, and it's at the top of page 8 in those guidance notes, is we will only fund that work within areas of deprivation within these 5 parts of Sussex. So I will say what they are now, but they are also in the guidance notes. So just please make sure that if that's the priority you're applying under, that you've focused your work in these areas. So that's Hastings and Rother, Bognor Regis and Littlehampton, Eastbourne, Hailsham and Seaford, Crawley and Brighton and Hove. Just to clarify, it isn't the whole of those areas, it's areas of deprivation within those communities. So for example, it's not all of Brighton and Hove, it's the areas of significant disadvantage within the city. If you're at all unclear, please contact us and ask if you're not sure whether what you're doing is going to kind of meet that that priority. We're really happy to have those conversations with you. Those areas of geography have been highlighted through indices of deprivation and other research within the Sussex Health and Care Partnership, in case anyone wondered where that's come from. I'm just going to quickly click on those questions because I've got a couple that have come in as we're going through. I'll do this one first because it's sorry, this one's quite long. Hang on. Okay, we've had a question. It's in some respects, it's specific to the organisation actually who has asked that question. Abby is my colleague. Can you just make sure that we capture that question? And for the person who's asked it around interpreting, I will come back to you with a more specific answer rather than doing it here. I will come back to you after the webinar. The next question is there a list or overview of who was awarded and for what in the first round to ensure you're not duplicating? There is a list. The reason it's not public yet is because not all of those organisations have signed grant agreements. And until they are contracted, we can't put out that information. It should hopefully be next week. We've got 2 who we are waiting on to return them, and then it will be press released and it will also be in the public domain on our website. So yes, absolutely. Yeah, no, that definitely will be. Sorry, these questions are now changing their order. So I'm trying to make sure I don't miss any. I'm really sorry. I'm going to answer these, but they're probably now all going to come out of order because I think they've moved around as I've answered them. There's a question, can partnerships include organisations that do not fully meet the eligibility criteria if the lead org does not? So if the lead org does fully meet the criteria, I'm going to come on to that one because I'm going to do a section on eligibility anyway. So I'm just going to make a note. Abby, can you just make sure that you don't make that one vanish for me, please, so I can see it when I get to the eligibility bit? Thank you. And I'm reading the question now about asylum seekers. Okay, this question, and it would relate not only, for example, to the city of Brighton and Hove, which has been asked about, it would relate to any city, for example, where somebody wanted to go and deliver this kind of work. The question is, in relation to areas of deprivation in Brighton and Hove, asylum seekers are not housed specifically in any area but are dispersed throughout the city. Will the current funding round make asylum seekers ineligible under the current criteria? No, it won't. I think the thing also about projects focused on refugee and asylum seeking communities is that they would also tick the access box in terms of funding priorities. That was, do you remember that was the first one that I mentioned? So one of the issues is about improving access to mental health care, particularly for groups who face additional barriers to accessing healthcare. That's one of the core groups that we would acknowledge have those difficulties. So no, they're definitely eligible. That's fine. And that would be the same if you were delivering that work in, say, I don't know, Crawley or Hastings. Same thing would apply. So it's okay that it would be covered across the city. That's all right. The question around interpreting has now vanished. I'm going to ask my colleague if they can get it back for me because somebody said actually they think the answer is relevant for everyone. If you bear with, we'll get that back and then I'll answer it. It's quite long. So it might be that my colleague can send me some notes or make it a bit shorter. Sorry, it's just because if I sit and read really long ones, it means I'm not talking. I'm really sorry, trying to manage it all. I should have said at the start, there's meant to be 2 of us doing this today, a different colleague to the one behind the scene, and she's poorly, so she's not here. So I'm covering other bits as well. So I'm really sorry if it feels a little bit clunky in places. Okay, right. I think that one is done. Okay, right. Bear with me, thank you. So we are just going back to my notes, make sure I cover everything. Okay, so I'm going to go on to eligibility, and then I'll come on to the actual application and the assessment process. So for anyone who's kind of scrolling in the guidance notes at the same time as I am, you're going to probably see this before me. But one of the first questions which we had with the last round, just to explain, is that this funding is only open to applicants from voluntary community or social enterprise sector. We had a few people who were NHS organisations who wanted, not Sussex Partnership, but others who wanted to apply last time, and it's not for them. It is for voluntary sector organisations. It is entirely possible that those voluntary sector organisations will have partnerships within the NHS, and not only Sussex Partnership, of course, but for example, with primary care and GP practices and things like that. That's fine, but we won't fund the NHS part of that project and that delivery. We will fund the voluntary sector part, but not the NHS part, which should be funded through the NHS, if that makes sense. So just to kind of highlight that. In terms of applications, you can only submit one application as a lead applicant at this round. And by lead applicant, that again, it is listed in the guidance notes, and it's on page 9. And there are different options depending on the kind of organisation that you are. So you might be a charity, you might be social enterprise, you might be a CIC, you might be a company limited by guarantee, but who is delivering activities which are charitable. But you must be able to meet the criteria that are outlined on page 9. I'm not going to run through all of them now, but I just want to confirm that they are the same that the Sussex Community Foundation uses. So we looked at different options in terms of this funding and what we would look for. Sussex Community Foundation ran some funding programmes last winter for the Mental Health Collaborative, and these are the criteria that they used then. So we've used the same ones now. Sorry, I'm in an office that the lights aren't working. Sorry, there's probably something quite poetic about that being in an NHS building where the lights have now gone out completely. It is the office that we're in, and it happened. They might come back on again. We're waiting for them to be fixed. I'm really sorry now that it looks really dark. But in terms of the lead applicant, you need to be able to meet all of those criteria that are outlined in there. And in terms of if you've got queries or questions about how you evidence any of that stuff, please contact us. We're really happy to have that conversation with you. You would need to be able to provide, as part of your application, either 3 years worth of accounts or records of expenditure. So it might be a link to audited accounts on the Charity Commission's website, but it might be something that isn't perhaps that you don't meet the threshold for that, so it's not quite as much. So please contact us. We can have those conversations. Part of the overall assessment process is a kind of financial review to make sure that you're able to manage your money, and also that you are a going concern, essentially, that you'll be around for long enough to deliver the programme. So as I say, please contact us if you've got questions. We absolutely are open to joint applications. In fact, we would really welcome those. There isn't a limit to the number of partners, but you do have to identify who's going to be the lead applicant. They must meet the eligibility criteria. That's who we will contract with, and they have to manage the grant. So if you are a partnership, we won't fund all of you paying you indirectly. We'll pay the lead applicant, and then they would be responsible for having ongoing partnership arrangements with their partners and a process for how they were going to pay them. In terms of what we will actually practically spend money on, we'll fund direct project costs, and we will make a project management contribution up to 10% of the total budget. We will only fund in Sussex, and as I've explained, within health inequalities, we'll only fund in those certain areas. In terms of funding only projects in Sussex, if you're based outside of Sussex as an organisation, but the work that you're going to deliver is in Sussex, that's completely fine. We'll do that. And we had applications last time from organisations that would have met that criteria. We won't fund anything that's not going to benefit communities in Sussex. As I say, we won't fund NHS provider organisations or other statutory agencies. We won't fund individuals. And some of this is, I'm sure you'd expect it. We won't fund organisations that are going to discriminate on the basis of protected characteristics they're listed in there. We won't fund activity that's predominantly research based. We want our funding to support direct project delivery. If you're doing bits of research kind of associated with it, that's fine, but we're not a research funder. We won't fund political activities. We won't fund retrospective work. So we won't fund anything that's happened before a funding decision. It's not the date you apply, it's the date you hear from us as to whether or not you've been successful. We won't fund capital expenditure. Buildings, equipment, that kind of thing. And then we won't fund activities that are the responsibility of statutory funders. So, for example, work which would be considered core NHS activity. I appreciate this is a point full of nuance, and there is a lot of work that is delivered within the voluntary sector that is meeting what might be perceived to be a core need. What we won't do is duplicate. For example, if there is a service that is already commissioned by the NHS, it's unlikely we're going to fund that. We won't fund core costs, so core organisational costs, although of course you can apply a proportion of those within the project management allocation. And we won't fund, we did have a few applications actually around this last time round. We won't fund any applications for anything that isn't direct delivery. So for example, we won't make a grant to an organisation who are then going to make other grants with our funding. You need to be delivering directly the thing that you apply to us for. So that's the eligibility part. And it does highlight in that section that last summer the largest grants we made were ones of 25,000 to single organisations. I think partnerships might possibly look a little bit different depending on what comes in the door this time. So I'm going to go through now the weighting and the assessment criteria, and essentially this is the section really around how to make sure that your application scores as highly as it possibly can. Again, please, I've seen I've got a question, and please carry on putting those in the Q&A part, and then also I'll come on to just some specifics of things to highlight from the first round that we think would be useful for you all to kind of hear and know about in this round. Sorry, so I'm just going to look at this question. Sorry, maybe I have, so I'll just read the question now. Can I clarify, please? You said only one application per lead applicant, but earlier said we could apply for both Innovate and Build in this round. Thanks. Sorry. I think, yes, I did, and I shouldn't have. It's one as a lead applicant, so you will need to choose which one you go for. Sorry. So one as a lead applicant, you'll need to pick, basically. You could be a partner, though, in more than one. Sorry, I'm really sorry, I got that wrong. If you, when you're making that choice, make sure that you are honest with yourself about whether your project is Innovate or Build. We did have quite a few applications last time who came into Build because Build had larger grants, but they were innovation. They'd never delivered that thing before anywhere ever. And they said in their applications, we want to test X, Y, and Z. That's not what Build is for. So even though the grants for Innovate are smaller, that's where that should go. So just make sure that you kind of pick the appropriate one, because otherwise, unfortunately, it just gets turned down. We won't move them. So you need to choose which of those pots you're applying to. Sorry, I've got some more questions. Is the application more likely to succeed if it is a partnership? No, not necessarily. Some of the ones we funded previously were and some weren't. So no, it doesn't matter. I'll come on in a minute to the things that you really need to think about in the application to make sure it scores really highly. But the question of whether it is or isn't a partnership, no, you're not more likely to get the funding. I would say that if it's a very large sum that you're applying for, you're more likely probably to get that if it's going to benefit wider groups or what numbers of organisations, for example. If it's a partnership, could the other partner be a newer organisation? Yes, and that I think is in the guidance notes. So, for example, if you're a newer organisation who might be quite small, that's fine for you to be a partner, but the lead applicant has to meet all of the criteria outlined in that section of the guidance, which starts on page 9, and it's called eligibility. And then another question, if we are able to be a partner org, are you collating a list of those who are happy to partner up? I have an outdoor venue that can be utilised. Thank you. That's the first person who's actually come to us to ask us to do that, to be honest. We haven't had anyone ask us for that sort of thing. If that person, if you want to contact us with perhaps a little outline of what it is that you would like to be able to do and what you've got to offer, or we can have a think about whether anyone has contacted us who would be a good person for you to link up with, and then we can do a little intro. But at the moment, we're not doing that. Nobody else has asked us to do that at the moment, actually. It's not to say we wouldn't, but we just haven't been asked to. Okay, that's all those questions in that section. So I'm going to go into then the section which is, oh, sorry, different screen, is on the guidance notes, which is called weighting and assessment criteria. Much earlier in the chat, I posted the link to the application form itself. That's much earlier, but what we are going to do is after today, like I say, we've recorded the webinar anyway, and we're doing some FAQs, so we will email not just the people who've come actually, but broader mailing lists with those links. So you'll get the links and the webinar, which will be on our website, and the FAQs as well. So if you think you've missed anything, don't worry, you'll get it later. So on the guidance notes then, we've put a section around weighting and assessment criteria. So this is directly linked to the application form that you need to complete. That form is on our website. It's a Word document. It's not massively long. It is possible that we may ask for additional information as part of the assessment process if our assessors come back with any particular questions, for example. Sorry, just going to have a quick drink. All the talking. Like I said, it's meant to be 2 of us. It's only me. Sorry, just got my voice for an hour. Sorry. So in the application form, some of it bog standard stuff that you would expect. So who are you? What do you do? What's your turnover? Who are your partners? That sort of thing. And then it's broken down into different sections with different headings. So those headings are the same ones that we've used in the guidance notes. So within REACH, which accounts for 15% of the scoring, so we use an aggregated scoring system, and each application has multiple assessors. The assessors are, so people in the heads-on team, NHS commissioners across the county, people with lived experience, and subject matter experts, voluntary sector experts. So it's quite a big list. So everyone scores individually and on their own, and then we use a system to aggregate those scores together, which is where the final scores come from. The threshold was quite high last time because in terms of success, because we had so many applications and a lot that scored highly. So in terms of REACH, and I'm not going to run through all of this because some of it you're going to know, and it's kind of the usual things you would expect. But within REACH, it's around who are you going to work with, really, how many, what kind of track record have you got with working with that group of people, and really importantly, how are you going to co-design the work that you do with the people who will benefit from that project. We would expect to see evidence of that co-design and user-led delivery within your applications, and you need to be specific around it. So don't just write, we will co-produce this thing with these people. You're going to need to give a bit more information about that, and also perhaps talk about how you've approached it before, what you've learned from that process. Maybe did it work, did it not work, will you do it differently this time around? And also how you're going to promote and make sure that the right people access this particular project. In terms of innovation and build, so that's worth 20% on the form, and then it's 2 parts. So if you're applying to innovate, you only do the innovate section. If you're applying to build, you only do that section. If it's innovate, tell us about the innovation within your project. Is it completely new? Are you testing an existing approach in a new area? Why do you want to do it? What evidence do you have that that's needed? And then within build, what existing work or success is that project building on? And what evidence is there of success, and therefore the need to scale up? One of the things that we found in the first round of applications was not all applicants provided the level of evidence we would have expected to see to kind of demonstrate that the work they were doing was already successful. So that's not me saying what you were doing was not successful. It's just in an application that was not evidenced well enough so that when assessors reviewed it, they didn't score highly enough, because actually in that application there wasn't the evidence there. So do please think about that. If you are applying to build and you're scaling something up, we would expect you to have evaluated that thing to demonstrate that you know it works, and also that if you maybe needed to make tweaks or changes based on the evaluation, that you had plans for doing that. So that's 20%. Impact accounts for 40% of the score, so it's the meatiest part on the application, and we are looking for what difference your project will make to your intended beneficiaries, what changes will happen, and what evidence is there to support the need for your particular intervention for that group of people. You need to tell us about how you're going to measure the impact of it and evidence it, and how that project's going to provide lasting benefit. We will want to know how you're going to know that the project has made a difference, and how will your beneficiaries know that it's made a difference, and what impact looks like for them, because what impact looks like for them might not be the same as what impact looks like for you. Then the next section is collaboration or partnership. That's 15%. For organisations who aren't partnerships, the aggregated scores are amended to reflect this, if that makes sense. So if you're not delivering in partnership, obviously you can't be scored against it. So if it is a partnership application, you need to tell us the practicalities of how that's going to work. So with the different partners, who's doing which bits of delivery, and their experience, skills, expertise that they would bring. For everybody, whether you're delivering in partnership or not, one of the aims of the overall transformation programme is building partnerships between the voluntary sector and the NHS, and actually all of those groups together. And I think lots of you are probably already members of the 3 voluntary sector mental health networks funded by the collaborative across the county that are looking to start to kind of do some of that work. So we would ask that you describe your current local VCSE partnerships and how you are going to work with them perhaps on the project, even if that's just kind of promotion and signposting and things like that. That I've just said, sorry, the other bits on there. And then in terms of sustainability and learning, this is 5%, but it's one of the areas that not many applicants scored well on in the first round. So that's in 2 parts, really, sustainability and learning. So one is, I'll do the learning bit first. So for example, what are you going to learn from that project? If you're piloting something new or developing a new piece of work, how will that benefit others, and how could it be shared? If it is build, what do you learn from the process of scaling it up, for example? Is it easier to deliver? Do you reach more people? Whatever that might look like. In terms of sustainability, this is the part that people didn't score as well on. We want to know how, if the project will continue after our funding ends, and specifically what plans you have around how you'll make that happen. So we've been asked to manage this £600,000 funding round. It's a one-off funding round. We haven't been asked to do it again. So we would expect in applications that people talk about, this funding will enable us to do X, Y, and Z, scale this from this place to here. We have already started conversations with these other people who might fund this on an ongoing basis, depending on how successful this is. This is what they've told us your funding might, or for example, under Innovate, your funding would enable us to pump prime this thing. We're going to test this thing. And we've started conversations about how we could make that sustainable. One organisation I spoke with this week is already working with some of their current funders who they get some small grants from to hopefully be able to extend the work by applying to their larger grants programmes beyond our funding. So we are looking for specifics around sustainability. If it's something that you're hoping might end up being delivered in partnership with the NHS and commissioned, talk about that in your application and how you're going about that. Applications that didn't score highly on this were the ones where they just wrote, we will fundraise to continue it after your funding ends. We would like to see more detail than that in the answers. In terms of sharing that learning, talk about how you're going to do it. Are you going to publish a report? Are you going to present the work anywhere? Is it linked to other maybe research? I said earlier we won't fund research, but some of the stuff we funded is linked to other research. So you might have ways that you're going to go and do that. Yeah, those sorts of things to talk about. And then funding in the final 5% of the scoring. We're looking for, it's not an overly detailed budget. You'll have to supply, if you're successful, we'll go through with it. You get a full template that you need to fill in, and we go through that with you. But in the initial application, we want a really clear budget, value for money, and make sure the social impact is clear, and make really clear what our money is paying for if there are other funders involved. So if you haven't got partnership funding, make it really obvious. You'd think if we're the only funder it would be, but that's not always the case. So please break down the things that you're asking us to pay for. If you have got partnership funding, make clear which bits we're paying for, what you actually want to do with our money, make that specific. So that's the kind of application and assessment part. I'm just going to, I think we've got a question, and then I'll just come on to some of the kind of overall bits of learning that we had from the first round, and any other questions that people want to ask. Would it still be valid if just one, sorry, I'm reading the question. Would it still be valid if just one service user was involved in the design, or should it be a group? I would suggest it needs to be more than one person, really only because one individual can't represent the needs of a whole group, and everyone will have different life experiences and different priorities. So I would suggest that co-design needs to be more than one person when you're doing it. It needs to be a group that are representative of the people that you work with, whatever that might look like. I think I've now, my colleague has also sent me another question, and I think that it's the same question that I've just in the chat popped up. Bear with me. I just want to make sure that I have covered everything. Sorry, clicking to make sure I've not missed it. Okay. Aaron, thank you. I've had, it is the same question. I've had, everyone can see it. I've had that question in different places. Heads On is managing this grants pot, but we're doing it on behalf of the collaborative and commissioners. I need to go away and get your answer checked before I give it. So I will do that, and I will include it in the FAQs. We are not commissioners, we're just managing this one grants pot. I want to make sure that I give the right information, and it's really a question around what are commissioners' expectations in terms of interpreting services. It's not so much about Heads On. We would cover interpreting if that was needed, but if commissioners' expectations are different, I want to make sure that we share the right information to answer that. So we'll put it in the FAQs, and we'll also send you an answer. I've seen your email on there, so thank you very much. We've also got that from when you registered. So yeah, sorry to not answer that now, but that's the reason why. And then we had another question. We deliver trauma therapy for survivors of sexual violence, which should be funded by the NHS. We are commissioned by NHS, but they only pay for 11% of our current delivery. Can we apply? Yes, you can. You would need to demonstrate the need for our funding, and also that as part of the assessment process, commissioners, just be aware, and actually for anyone who is delivering something where you do get some commissioning money, one of our assessment criteria is we won't fund work that is considered to be core NHS provision. So it is part of the assessment process, and it will involve us, for anyone, not just that organisation, but for anyone who is in receipt of commissioning money. The assessment process involves us talking to those commissioners about added value, basically, and is it core service, and what are the bits perhaps that might be considered additional that you could apply to us for. So is it going to extend the work? Is it going to reach new communities? Is it going to be bigger geography? Those sorts of things, I think, are the things that people would need to think about, because we won't duplicate commissioned work. And I'm sorry, it's really difficult to give a black and white answer to that question. Yeah, it's just hard. I'm sorry, to be really honest. It is a challenge because of the kind of crossover, really, between organisations. The people who are applying to us, not all, but quite a lot, have got commissioned funding, and it's just making really clear that this is grant funding and it's not that commissioned money. I would suggest that particular person, if you could drop us an email, really happy to have a conversation with you and work out a bit more of the detail of that, because I'm conscious I'm trying to give a general answer that would apply to anybody. Happy to have the conversation around the specifics there. I think you would need to demonstrate for anyone in that situation that what you're asking us to do is not replicating your core NHS funding, whatever that might be for. But I think that's going to be different for different people. So I would suggest anyone in that situation contacts us separately and we can have that conversation. Got 8 minutes left, so I'm going to very quickly just talk about the first round and what we learned, and then there's definitely, please keep putting your questions in the chat because that's really helpful. As I said, over 1.5 million of applications for less than £300,000. So demand is high. When you are developing your applications, bear in mind that we are expecting the same, if not more, this time, because this is the last funding round for Innovate and Build. So somebody asked me the other day, are there plans for this to be continued? And at the moment, no. Whether that's with us or anyone else managing this money on behalf of the collaborative, this was a one-off opportunity. So because of that, I think because it's the last deadline at the end of this month for Innovate and Build, we probably will get quite a lot of applications. And if the last lot's anything to go by, the quality will be very high. Anyone who applied to the first round, you must contact us for feedback on that application before you reapply, particularly if you're going to reapply for the same project. So please make sure that you've done that. It's a quick call with one of us in the team who will give you feedback from the assessment process and anything that needs to particularly be considered. If you were told that your application is ineligible, please ring us. But the likelihood is you wouldn't be able to submit that this time round unless the ineligibility is something that you would be able to fix. Remember what I said around the ones that scored the highest being the ones that were most closely aligned to the overall transformation programme, and particularly focused on people with severe and enduring mental illness. And just think about that when you are developing your applications. In terms of what people could have done differently in their applications to score more highly, I've talked about sustainability question and making sure that that's answered in detail. Some applications, not all, weren't as specific as they could have been about who their project was targeting. So, for example, I'm trying to think of a sensible example, rather than saying that your application is going to reach all women in a certain part of Sussex, for example, talk specifically about who are you talking about. Are you talking about women with complex trauma, for example? Are you talking about women who are pregnant and need access to perinatal support? Whatever that might be very specific about who you are targeting and how that aligns to the transformation programme, and how you know that your intervention is needed for those people, and how you know that group. And if it's a group that you've never worked with before, but you're going to perhaps build something that's worked with a different group that you think has got potential, tell us the evidence for how you know that that thing has got potential. The evidence overall is really important. So evidence the need for your work. So that might be through previous evaluations that you've done yourselves, or others that have perhaps been commissioned that have been external to you, feedback from service users, and it also an evidence base that you can gather from research, for example. So it might be local evidence of need, or it might be national, and that actually there is this need locally, this has been delivered elsewhere in the country, and we're going to go and do it here. So those are things to really kind of think about, because the applications perhaps that didn't score quite as highly last time round didn't do those sorts of things, and the ones that scored better did. I've kind of highlighted the issue around, is your project innovation or is it build? Be very clear about that. Interrogate yourselves about, are you testing something or are you rolling something out? And just my plea is, please don't be led by build having higher grants. I know that's really hard to do, and I sit on both sides. I'm a fundraiser and a grant maker, so I know what that's like. But if you're testing something new genuinely, it won't get funded through build, and we know that build will probably receive far more applications than innovate, because that's what happened last time. That's why the funding amounts are set as they are. So innovate, we've got 75,000 to allocate, and we've got 180,000 for build. But it does, be led by what the project actually is, rather than the distinctions around grant amounts. And just bear in mind what I've said really about the kind of competitiveness of the funding and the number of applications that we think that we will receive. I've got 3 minutes. I'm probably going to wrap up. I have, oh, no, I was going to say no more questions, but there is a question. That's fine. If you've got more questions, quickly type them in and we'll answer those. If you have got specifics around your project that you would like a quick chat with one of us about, please do drop us an email. I'm going to very quickly put the email address in the chat so that you've got that. It's a shared inbox, so it will be me or one of the team who will pick these up, and we can have a quick conversation, and also, as I say, help with links to different parts of the NHS or Justice Partnership or commissioners or whoever it is that you might need. Oh, sorry, they're two. It's not two questions. It's actually one question. Essentially, it's saying that if we were oversubscribed with applications to build and undersubscribed with applications to innovate, would we look at moving money between the two? We might, and that's all I can say. What I would say is that there is a reason that innovate has been retained, and it is because the collaborative want to see innovation within the programme of work that's delivered in Sussex. If we didn't want innovation, we wouldn't have it as a funding priority. So I would just say that we are looking for innovation. We want to see projects that are trying to do different things and new things in Sussex. Otherwise, we would have only had build. So I would say it would probably be a reluctant move. But yes, we would consider it. I mean, the other thing is, and this was definitely the case for the first time, and it will be the case this time around as well, we're led by the scores. We will only fund really good quality. So if what we got wasn't, we wouldn't fund. So I think that's the other thing to bear in mind, and that would be the same across innovate or build. And volume isn't always indicative of quality. Sometimes it is, but it's not always. So I would say that the scoring is absolutely where decisions are led. That's definitely the case. And the aggregated scoring means that those voices in terms of who is inputting into the assessment process are broad. So yeah, just bear those things in mind, really. And it's a one-off deadline. It's noon on the 31st of January, and you need to email that form to us by then. If you don't, we won't consider. Oh, we had so many applications in the first round. We'll get the same this time. If applications are late, like any other funder, we won't consider them, I'm afraid. It is noon on that day. We're really happy to answer questions, and I really hope you found this morning useful. We will send out later on this week the links for the webinar and the FAQs today. I'm sorry I was a bit quick at points, but I have managed to nail it bang on 11, which for those in my team know is very rare that happens. So yeah, thank you all very much for your time this morning. Do follow up with specifics if you need to, and good luck in applying, and we really look forward to your application. Thank you, everybody.